You've been told your medications are keeping you alive. But after 70, 5 of the most commonly prescribed drugs in America may be doing the opposite. Not because they stopped working, because your body stopped processing them the way it did at 50. Researchers at Johns Hopkins tracked over 11,000 patients above 70 for 8 years and found that specific drug classes triple the risk of falls, cognitive decline, and sudden cardiac events in this age group compared to younger adults taking identical doses. The mechanism isn't drug failure, it's biological transformation. Your kidneys filter at half the speed they did 2 decades ago. Your liver metabolizes compounds 30 to 40% slower. But your prescriptions haven't changed. The dose that stabilized your blood pressure at 60 might be flooding your system with excess medication at 72, and the symptoms you're dismissing as normal aging could actually be chronic overmedication. We're going to walk through 5 drug classes that become high risk after 70, what they're doing inside an aging body, and why doctors who specialize in geriatric pharmacology are now calling for mandatory re-evaluation at this age threshold. But before we go further, there's something you need to understand about medication accumulation over time. If you're dealing with multiple prescriptions and want a complete system for managing them safely after 70, there's a protocol designed by geriatric specialists that breaks down drug interaction risks, safe tapering schedules, and alternative therapies based on your specific combination of medications. It includes timing adjustments that reduce side effects by up to 60%, supplement support that protects kidney and liver function during transitions, and a medication audit checklist built specifically for people over 70 with multiple chronic conditions. The link is in the description below or pinned at the top of the comments. Here's what makes this age threshold so medically significant. After 70, your glomerular filtration rate, the measure of how well your kidneys clear waste and medications from your blood, drops by roughly 1 milliliter per minute for every year you age. That sounds minor until you realize most drug dosing guidelines are based on kidney function tested in middle-aged adults. A study published in the Journal of the American Geriatric Society found that nearly 40% of adults over 70 are taking at least one medication dosed too high for their current renal function. The drug doesn't leave your system as quickly as it should. It accumulates. Serum levels rise. And what was once therapeutic becomes toxic. Your liver tells a similar story. Phase 1. Metabolism, the process that breaks down most medications, slows dramatically after 65. Cytochrome P450 enzymes, the workhorses of drug metabolism, become less efficient. Meanwhile, your body composition shifts. You lose muscle mass and gain fat tissue, which changes how drugs distribute and how long they stay active in your system. Fat-soluble medications linger longer. Water-soluble drugs concentrate in smaller fluid volumes. The result is longer half-lives, stronger effects, and more unpredictable interactions between medications. This isn't about one pill. It's about how 5 or 6 prescriptions, all dosed for a younger metabolism, create a compounding biological burden your aging body can't safely manage. The drugs we're about to cover aren't inherently dangerous. They become dangerous when your physiology changes and your prescription bottle doesn't. First on the list, benzodiazepines, the class that includes lorazepam, diazepam, and alprazolam. These are prescribed for anxiety, insomnia, and muscle spasms, and if you're over 70 and taking one daily, you're carrying a full risk that's nearly 4 times higher than someone not on these drugs. A meta-analysis in JAMA Internal Medicine reviewed 47 studies and confirmed that benzodiazepines are directly linked to hip fractures, traumatic brain injuries, and fatal falls in older adults. The mechanism is straightforward but devastating. Benzodiazepines enhance the effect of GABA, a neurotransmitter that slows brain activity. In a younger person, this produces calm. In someone over 70, especially someone whose brain is already experiencing age-related changes in receptor sensitivity, it produces sedation, confusion, and severely impaired balance. Your reaction time slows. Your spatial awareness dulls. You stand up from a chair and your body doesn't correct for the shift in balance the way it used to. You trip on a rug you've walked past for 20 years. But here's the part that makes this even more insidious. Benzodiazepines have a long half-life in older adults. A single dose of diazepam, which might clear a 50-year-old system in 30 hours, can linger for over 90 hours in someone 75. That means the drug is active in your body days after you take it, compounding with each new dose, building up to levels that create what looks like dementia, but is actually drug-induced cognitive impairment. Research from the University of Washington found that long-term benzodiazepine use in adults over 65 increases dementia risk by 50%. If you've been on one of these medications for more than 3 months and you're noticing memory lapses, trouble finding words, or balance issues you didn't have a year ago, this might not be aging. It might be your prescription. Second, proton pump inhibitors, the heartburn medications like omeprazole and esomeprazole that millions of people over 70 take every single morning. These drugs shut down the proton pumps in your stomach lining, the tiny molecular machines that produce stomach acid. For short-term relief, they're effective. But after 70, long-term use creates a cascade of nutrient deficiencies and infection risks that most patients never connect to a pill they think is harmless. Stomach acid isn't just for digestion. It's your first line of defense against pathogens. It activates enzymes that break down protein. It's essential for absorbing vitamin B12, magnesium, calcium, and iron. A study in gastroenterology followed over 73,000 patients on PPIs for more than 2 years and found a 25% increase in chronic kidney disease and a 65% increase in serious bone fractures compared to those not taking the drugs. The magnesium depletion alone is enough to trigger arrhythmias. The calcium malabsorption weakens bones that are already losing density. The B12 deficiency mimics Alzheimer's, causing memory loss, confusion, and nerve damage that can become irreversible if it continues for years. And because your stomach acid is suppressed, bacteria that should be killed in the stomach survive and colonize your gut, leading to overgrowth, diarrhea, and a significantly higher risk of pneumonia and C. Difficile infections. If you've been on a PPI for more than a year, especially if you started it for mild reflux and never stopped, your body is likely paying a price you're attributing to age. The brittle bones, the fatigue, the brain fog, these aren't inevitable. They're side effects. Third, anticholinergic medications, a category that includes drugs for overactive bladder, allergies, depression, and sleep. Names like oxybutynin, diphenhydramine, and amitriptyline. These block acetylcholine, a neurotransmitter critical for muscle contractions, glandular secretions, and most importantly, memory formation and cognitive function. After 70, your brain has fewer acetylcholine receptors to begin with. Blocking the ones you have left doesn't just dry out your mouth and blur your vision. It shuts down cognitive processes you depend on to stay sharp. A landmark study from Indiana University School of Medicine used brain imaging to track older adults on anticholinergics and found measurable brain atrophy and significantly lower glucose metabolism in the brain, the same metabolic pattern seen in Alzheimer's disease. Patients taking these drugs scored worse on memory tests, had slower processing speeds, and showed clinical signs of dementia at rates far higher than expected. The terrifying part is how insidious this is. You don't wake up one day and forget everything. You start misplacing your keys more often, you lose track of conversations, you walk into a room and forget why. Everyone around you, including you, assumes it's normal decline. But if you're on one of these medications and the cognitive slippage started or accelerated after you began taking it, the drug is likely the cause. Discontinuing anticholinergics has been shown to partially reverse cognitive impairment in some patients, but only if the damage hasn't progressed too far. The longer you're on them after 70, the harder it becomes to recover what you've lost. If you're taking a medication for bladder control or sleep, and you've noticed your thinking isn't as clear as it was 2 years ago, this is the connection your doctor might not be making. Fourth, NSAIDs, the non-steroidal anti-inflammatory drugs like ibuprofen and naproxen that people over 70 take daily for arthritis, chronic pain, and inflammation. These are available over the counter, so most people assume they're safe. They are not safe after 70, especially not at the doses many people take without thinking twice. NSAIDs work by blocking enzymes called KOX1 and KOX2, which produce prostaglandins that cause inflammation and pain. But those same prostaglandins protect your stomach lining and regulate blood flow to your kidneys. When you block them, you strip away those protections. A study in the American Journal of Medicine found that adults over 65 taking NSAIDs regularly had a 60% higher risk of gastrointestinal bleeding and a 50% higher risk of acute kidney injury compared to non-users. Your kidneys are already filtering more slowly. NSAIDs constrict the blood vessels that supply them, reducing filtration even further. Over time, this leads to chronic kidney disease that becomes irreversible. Your stomach lining, no longer protected, begins to erode. Ulcers form. Bleeding starts, often without obvious symptoms until you're anemic or passing black stool. And if you're on blood thinners, which many people over 70 are, the bleeding risk multiplies. NSAIDs also raise blood pressure, interfere with the effectiveness of blood pressure medications, and increase the risk of heart attack and stroke. The FDA issued a warning years ago about cardiovascular risks, but the message hasn't reached the millions of older adults taking these drugs daily because they have always worked, and no one told them to stop. If you're 72 and reaching for ibuprofen every morning, you're not managing pain. You're creating a slow-moving crisis in your kidneys and digestive system that will eventually demand far more serious medical intervention than the ache you're trying to quiet. Fifth, and this is the one that surprises people most, certain blood pressure medications, specifically alpha blockers like doxazosin and terazosin. These are prescribed to lower blood pressure by relaxing the muscles in blood vessel walls, and they're also used to treat prostate enlargement in men. After 70, they become a leading cause of orthostatic hypertension, the sudden drop in blood pressure that happens when you stand up too quickly. Your blood pressure plummets. Your brain doesn't get enough oxygen for a few critical seconds. You feel dizzy, your vision tunnels, and you collapse. Research published in Hypertension tracked older adults on alpha blockers and found they had more than double the rate of falls, resulting in fractures, compared to those on other blood pressure drugs. The problem is that your body's ability to regulate blood pressure dynamically, adjusting quickly when you change position, declines with age. The baroreceptors that sense pressure changes become less responsive. Your heart rate doesn't compensate as quickly. Adding a drug that further relaxes blood vessels means your system can't recover fast enough when you stand. The fall happens in seconds. The hip fracture that follows can end independence permanently. In adults over 70, a hip fracture carries a 1-year mortality rate of nearly 20%. 1 in 5 people who break a hip after 70 will be dead within a year, not from the fracture itself, but from the complications of immobility, infections, and the cascade of decline that follows. If you're on an alpha blocker and you've had moments of dizziness when standing, episodes where you had to grab onto something to keep from falling, or even one fall that seemed to come out of nowhere, the medication is very likely the cause. There are other blood pressure drugs that don't carry this same risk profile in older adults, but you have to ask for the change. Your doctor won't automatically switch you just because you turn 70. So what do you do if you're on one or more of these medications? First, understand that stopping suddenly can be dangerous, especially with benzodiazepines, which can cause seizures if discontinued abruptly. You need a tapering plan supervised by a physician, ideally one trained in geriatric medicine who understands how to adjust doses for aging physiology. Schedule a medication review. Bring every prescription, every supplement, every over-the-counter drug you take. Ask specifically about alternatives. For benzodiazepines, cognitive behavioral therapy for insomnia has been shown to be more effective long-term than medication. For PPIs, new blockers like famotidine are less risky for long-term use, and lifestyle changes, elevating the head of your bed, avoiding late meals, can eliminate the need for daily acid suppression. For anticholinergics, there are often newer drugs in the same class that don't cross the blood-brain barrier as easily. For NSAIDs, topical formulations, physical therapy, and targeted corticosteroid injections can manage pain without systemic risk. For blood pressure control, ACE inhibitors and calcium channel blockers generally have better safety profiles in older adults than alpha blockers. The key is this: your medication list should be re-evaluated every single year after 70, and every time a new drug is added, something old should be questioned. Polypharmacy, taking multiple medications simultaneously, is one of the strongest predictors of adverse drug events in older adults. The more drugs you take, the higher the chance of dangerous interactions and cumulative side effects that no single drug would cause on its own. Let's recap what we've covered. First, benzodiazepines quadruple your fall risk and are linked to dementia when used long-term after 70. Second, proton pump inhibitors deplete critical nutrients, weaken your bones, and increase infection risk when taken for years. Third, anticholinergic drugs cause measurable brain atrophy and cognitive decline that mimics Alzheimer's disease. Fourth, NSAIDs damage your kidneys, erode your stomach lining, and raise your cardiovascular risk, all while you think you're just treating arthritis pain. Fifth, alpha blockers cause dangerous blood pressure drops that lead to falls and fractures with devastating consequences. These aren't rare side effects. They're predictable outcomes when drugs designed for younger bodies are used in physiologies that have fundamentally changed. If you're on any of these medications, the next step isn't panic. It's a conversation with your doctor about safer alternatives and whether you still need the drug at all. You've now seen how these 5 medication classes interact with an aging body in ways that weren't an issue when you were younger. What you need next is a full system that helps you manage the transition safely, especially if you're on multiple drugs and dealing with overlapping conditions. There's a detailed protocol in the description that covers how to approach medication reviews with your doctor, which lab tests to request for monitoring kidney and liver function, the safest tapering schedules for drugs that can't be stopped abruptly, and alternative therapies that address the same conditions without the high-risk side effects, designed specifically for adults over 70 managing chronic conditions with multiple prescriptions. The link is in the description below or pinned at the top of the comments. Your prescriptions were written to help you, but after 70, some of them may be the very thing standing between you and the clarity, stability, and independence you're trying to protect.